Hi everyone, my name is Amy, and I'm going to be sharing with you my PowerPoint presentation on one of the most prevalent problems in childhood today, child sex abuse. So first we need to define child sexual abuse, which is, I have this little acronym here, CSA. I live in Pennsylvania, so I went to the Pennsylvania Code, which is the legal doctrine here in Pennsylvania. And I have this hyperlink up here for anybody that's interested in reading the full scope of the law, but I'm just going to hit the highlights. So basically, in Pennsylvania, child sexual abuse is defined by three factors. There's some sexually explicit conduct that's occurring. There are a number of sexual offenses, and there's some type of exploitation. So just in brief, the law states that if any of these things are committed on a child by a perpetrator, this is considered sexual abuse or exploitation under the Pennsylvania laws. So a perpetrator may use or persuade, induce, entice, or coerce a child to engage in or assist another person to engage in sexually explicit conduct. It doesn't have to be in person. There could be some type of simulation as well of some sexually explicit conduct for the purpose of producing, a visual depiction like photography, a video. People use computers to film sexually explicit conduct. The specific offenses under the law are rape, statutory sexual assault, involuntary deviant sexual intercourse, sexual assault, aggravated indecent assault, indecent exposure, incest, prostitution, and in terms of the exploitation piece, there would be looking at sexual or other intimate parts of a child for the purpose of arousing or gratifying the perpetrator, or engaging or encouraging a child to participate in sexually explicit conversation, either in person, on the phone, by a computer or a cell phone, some type of computer-aided device. And also engaging or encouraging or looking at sexual or other intimate parts of the child, or encouraging a child to do that. So that's the law. Now, the scope of CSA, there's some pretty alarming statistics that I was able to find. I also have another hyperlink on here to this great website that captures far more than what I've included here. But it's really useful for understanding the enormity of this problem for children. So childhood sex abuse is considered the most prevalent, or at least one of the most prevalent health problems that children face. Approximately 1 in 10 children will be sexually abused before age 18. 1 in 7 girls and 1 in 25 boys will be sexually abused before age 18. Children are sexually victimized at a much higher rate than adults, and this is, when you take into consideration that children do not disclose as often as adults, it really puts this problem into perspective. Only 38% of children who are sexually abused actually disclose. So the numbers those numbers are considered conservative. On a global level, it's estimated that 7.9% of males and 19.7% of females have been victims of childhood sexual abuse. And in the United States, it's estimated as many as 25.3% of females have been victims of CSA. In Pennsylvania, where I live, there was the Pennsylvania Department of Human Services put out their report in 2016. And there were 3,078 substantiated allegations of child sexual abuse. Almost half of the total substantiated allegations of abuse involve sexual abuse. and it is estimated that the child knows the perpetrator. I found some, in 90 to 95% of reported cases, I found some conflicting statistics on that. I found some said 95%, some said 90%. Again, I live in Philadelphia, so I have this great map here. I have this great map here that shows, this is a map of the city of Philadelphia and the different neighborhoods. And this shows how many substantiated cases of sexual abuse occurred in each neighborhood. And anyone that lives in Philadelphia that sees Nicetown, Port Richmond, Frankford, Germantown knows that those are some really struggling communities. Southwest Philly, where it says Kincessing, 180 substantiated cases. In the more wealthier neighborhoods, you'll see far less. Chestnut Hill is probably the most wealthy neighborhood in Philadelphia, and you can see that there were only 5 cases there. And also in the Center City districts, 19103 and 19107, 2 and 6 cases. So there's definitely, this map definitely shows a correlation between socioeconomic status and other social forces at work when we're considering who's actually being abused. So we can talk about some specific factors, some specific risk factors for being a victim of child sexual abuse. So we should take into consideration poverty, poor education of the parents, parental substance abuse. If there's a child living in a single parent household or has divorced parents, that increases the risk. If there's any type of existing abuse and neglect, that's going to increase the chances that a child is going to suffer from child sexual abuse. If a child has learning disabilities, there's strong correlation that this population is extremely vulnerable to sexual abuse, as well as children who are impulsive and needy. Needy meaning emotionally. They need, they like to hug. They crave physical contact that actually increases the risk of something happening. Some additional at-risk population information that this chart is showing is adolescents that are engaged in the sex trade, meaning kids that are out on the streets, they're runaways, they're found to, they trade sex for survival, like things that they need for survival, food, shelter, money. Children in high conflict environments. What this means is children that are maybe refugees, that are newly immigrating, are in a war zone. That's what that refers to. Children who identify as in the LGBTQ community are also at a higher risk of experiencing child sexual abuse, as well as those with physical disabilities. And again, this population, the literature shows that these kids are at an increased risk, maybe slightly higher than other populations. Physical disabilities, blindness, deafness, maybe they are paralyzed. Some type of physical disability puts them at a serious risk of childhood sexual abuse. I'd just like to give some specific statistics with regard to some of these risk factors and population information. In households where there's one parent missing, those children are 10 times more likely to be victimized than kids who live with both biological parents. In a single parent household, kids are 20 times more likely to be victimized than those living with both of their biological parents. And in terms of gender, girls are more than 5 times more likely to be abused than boys. And 8% of victims are aged 12 to 17 are boys, and 26% of victims under age 12 are boys. Race and ethnicity also increases the risk. African American children are at a 2 times greater risk than white children, and Hispanic children are at a slightly greater risk than white children. Socioeconomics is definitely a risk factor. Children who have parents that are unemployed are at 3 times the risk of being sexually abused. And also those children who are living in low socioeconomic conditions, they come from a low socioeconomic background, increases their risk by 3 times. And I think it's important to mention sibling abuse. Sibling sexual abuse is actually one of the most underreported of all child sex abuse acts, yet sibling CSA accounts for a very significant number of victims. The other thing that's important to mention is in this case, when a sibling reveals that they've been abused by a brother or sister, one particular study noted that parents, teachers, and mental health professionals, once they were told about the abuse, they were actually less likely to report it. Okay, I'd like to talk briefly about the history of CSA in the United States. There are some specific laws. The first such law was the Child Abuse Prevention and Treatment Act, which was enacted in 1974. It's rather well known as CAPTA. And this act was actually amended in 1996. It actually addresses minimum standards of child abuse definitions and reporting. And I also wanted to mention that prior to the 1970s, this problem of child sexual abuse was largely unrecognized by society. Actually, claims of sexual assault made by children and women were often dismissed, and historically, only physical abuse was considered in the country's protection laws. There were actually 3 pioneering workers who changed this law. Or helped create CAPTA. I want to mention Vincent DeFrancis. He actually testified before a Senate subcommittee on children and youth back in 1973, working to establish the National Center for Child Abuse and Neglect. He stated at that time, this is his actual testimony, that somewhere between 30,000 and perhaps 40,000 at the outside of truly battered children, but there must be at least 100,000 children each year who are sexually abused. The stigma of sexual abuse at the time, and it continues today, was so powerful that even medical professionals, including social workers, did not provide any information in the medical literature with regard to the topic. Even pediatricians were reluctant to document incest in treatment records. However, a change in reporting laws at that time required professionals for the first time to report the abuse. And the effect was so profound that between 1977 and 1978, almost every national magazine ran a cover story highlighting the horrors of children's sexual abuse. Another noted researcher, David Finkelhor, he authored a groundbreaking book called Sexually Victimized Children in 1979, and that was in response to this explosion of reported child abuse cases that occurred as a result of the law changes. There's some pretty staggering statistics that he noted at the time, along with another researcher, Diana Russell. She indicated that she surveyed 900 women randomly about their childhood sexual experiences and concluded that 38% of them indicated that they were sexually abused as children. So as a result of these 3 individuals, of their work, the legislative work, and social attention, CAPTA was born. Here are some, coming up on the screen, some additional laws that came into effect. subsequent to CAPTA. We have the Adoption and Safe Families Act of 1997, the Child Abuse Prevention and Enforcement Act of 2000, the Family Preservation and Support Services Program of 1993, Strengthening Abuse and Neglect Courts Act of 2000, and Promoting Safe and Stable Families Program Reauthorization of 2002, and of course the National Megan's Law.